Well, welcome everybody. I'm Dr. Michael Karlfeldt. I'm here with Dr. Tilden Zokolof, and one of the things that we are doing here in Idaho is that we are driving a naturopathic licensing bill to open up licensing avenues for other naturopathic doctors that have not gone to very specific naturopathic schools. So, Dr. Zokolof, you felt very passionate. You're a medical doctor yourself, and you have quite an esteemed background. Why do you feel that this is a need for you?
Well, I think the reality is it's been a need for 20 plus years that we've had a history of legislating or attempting to legislate access to natural medicine, functional medicine, lifestyle medicine, naturopathic medicine, call it what you will, but equal training for people of various and sundry backgrounds, be it MD, DO, nurse practitioners, PAs, DCs, DPMs, DDSs, NDs, who have been shortchanged because of not having the access and third-party reimbursement that are enjoyed by all health providers. So if somebody comes to you, Dr. Karlfeldt, and doesn't have the wherewithal to pay your fee, they have no ability to have support from an insurance carrier to assist in that, to access your skill base and your wheelhouse of skills through the ability to have the need for blood tests or functional medicine tests or intracellular antioxidant studies. None of that is going to be reimbursable by a third party because you're just not eligible to be reimbursed. You're not in that world. So that is an inequity that needs to be fixed. And when we help to basically get legislation for the folks that graduated accredited naturopathic medical schools, the AANP and our association, as well as the political leaders in Idaho, made a handshake deal that they would create licensure for all those that couldn't have been on that board or licensed by that board because of the confinement of the degree had to come from Bastyr, National, Southwest, or one of their accredited schools. And we're in a situation right now where we're promoting legislation to enable that group of qualified, already licensed in many instances, practitioners, many of whom have licenses in many states, DEA registration, but they have further credentials in naturopathic medicine and functional medicine to enable them to provide naturopathic care. And they want to be licensed by one board, not by 2 or 3 boards to enable that.
So as you're mentioning, for the benefit for the consumer is that they will have a greater access to natural care and then have the chance of having a third-party reimbursement, meaning that insurance companies are then able to pay, more likely than to pay for that, since the practitioner is licensed as a naturopathic doctor. But then you also mentioned in regards to the qualifications then of the doctor that would be eligible for that license. I mean, currently we only have a very select group of naturopathic doctors that are eligible in other states, and here we are then wanting to open that up to other doctors that may not have gone to these very specific naturopathic universities, but have a very esteemed background, being medical doctor, dentist, whatever type of physician, and they have then kind of extended their training in natural medicine as well. So how can we, one of the big concerns obviously is for the public, what kind of protection do they have? I mean, they're obviously concerned about safety. So how safe should they feel in regards to this group of naturopathic doctors having, being licensed?
Well, that's a good question. I think the reality is that right now, It's the Wild West governed by the Smith Act. And in the wisdom of the politics of Idaho, the Smith Act enabled people to practice their skills in natural medicine, providing they didn't infringe on the practice of medicine. Now, that's a very broad stroke brush, but every practice infringes on the practice of medicine. If you need a CBC, or if you need a chemistry panel, if you listen to a patient's heart, if you have to take a blood pressure, that's all part of the gamut of the practice of medicine. So there has been a very safe provider group within the state of Idaho that have practiced natural health care for decades, many, many, many decades. Our association, the Idaho Naturopathic Physicians Association, was incorporated in Idaho in 1952, long before there was ever any naturopathic school that was graduating students from an accredited school. And these were folks that graduated from chiropractic institutions, which used to give naturopathic degrees along with the chiropractic degree. And they basically, because of a deal made with the AMA in the early 50s, that they would get better recognition from the AMA, American Medical Association, if they disassociated themselves from drugless practitioners and naturopathic practice. And Western States College, which is now the University of Western States in Portland, Oregon, was the last school to stop giving the ND degree along with the DC degree. And it was the year they stopped was the year National College was born of naturopathy. It was National College of Naturopathy. And that was born, and it was a 2-year school at that time. So those people that graduated with dual degrees and practiced naturopathy, naturopathic medicine, natural healing in the state of Idaho, and delivered a lot of naturopathic primary care were here. And they were smart enough to incorporate an association of providers, which ensured continuing education of the group, which ensured that there would not be a closed door, that there would be a future to that association. So it has grown into a great group of people and providers, of well-trained people of diversity. And that group, its membership is MD, DO, DC, DDSs, DPMs, nurse practitioners, the whole gamut of healthcare. So when you say qualifications, licensure only ensures the vetting of these people to a further degree, a higher level where there's enforcement procedures if somebody steps along a line that they shouldn't have, or a person's been endangered by someone who provided care that was not competently performed. That's really an important facet in any healthcare profession, to have that for the public and to have that safety net and know that that individual, he or she, has been vetted by the state of Idaho. So that's a very good question to ask. And that they've already been vetted by their own boards. So if the individual's an MD or a DO or a nurse practitioner or a PA or a dentist, they've already been vetted by their own boards and been licensed by them.
So with that, I mean, obviously that will ensure safety, for the public, so that they know that these people are already qualified to practice in a safe manner to the public. But what would be the benefit of them, such as yourself? I mean, you're a medical doctor, and a person coming to you, I would assume they'd be able to use insurance. What would be the benefit for you to have a naturopathic doctor's degree or license?
I think the benefit to anybody who has credentials that wants to limit their focus of practice to natural health care does not require a medical license, an osteopathic license, a nurse practitioner's license. If they can get qualified under a naturopathic license, they can provide those services to one board and not have to divide themselves into 2 or 3 boards to be capable of delivering that type of care. And that becomes a financial issue for them for licensing fees, malpractice issue for them. One coverage, in terms of one insurance coverage, will take care of their practice needs to protect their patients and themselves. So I think it brings to bear the power of one license to provide natural health care according to your core competencies.
And I would also, we have this concept of standard of care within the medical model, where medical doctors expected to give a certain type of pharmaceutical treatment, certain type of treatment to a patient that exhibits certain symptoms or has certain disease. So I would assume that this would open up their ability to be able to give other types of treatments.
Yes, well, I mean, I think the standard of care, let's say IV therapies, nutritional therapies, administering amino acids or various and sundry types of PRP injections, or issuing certain of therapies that are not within the domain of what you would consider the normal standard of care in medicine or osteopathy. They would become the standard of care within the naturopathic community, and the public would benefit by that, because instead of the individual delivering that